Principal Emission Consultant at TrueLink Emission Services. TrueLink is a Canadian-based emission firm. We have a head office in Edmonton, Canada, and we have a branch office in Nigeria. Our Nigeria office is actually in Ibadan. So today, we're going to be talking about free healthcare services in Canada. And the topic is free healthcare services in Canada, a good reason to migrate to Canada. But before we go on with that, I would like to talk briefly about TrueLink. As I said earlier on, TrueLink is a Canadian-based emission firm. We have a head office in Edmonton, Canada, and we have a branch office in Nigeria. So if you want to migrate to Canada, you want to study in Canada, you want to work in Canada, you want to visit Canada or invest in Canada, we can be of help. We have actually assisted so many people to migrate to Canada. I also migrated to Canada, and this is what we have done for ourselves. We're not just telling you what we can do for you. We are talking about what we have done for ourselves and those working in our office in Canada and many other people who are actually now living in Canada and working in Canada. We're actually licensed by the government of Canada to do what we do. We are licensed to assist people to migrate. It's not all agents or travel agencies that are licensed. You can find out that. But we are licensed by the government of Canada to do what we are doing. So you can rest assured that your work will be handled professionally. So today's topic, we are going to be talking about free healthcare services, a major reason why you should consider migrating to Canada. I'm sure you know that healthcare is central to human happiness. In fact, there's a saying that goes by, health is wealth. And for those that may not know, I want to assume that why people say that is because if you lose your health, you lose your wealth. Many of us, we think we are still young, we are very active, we are working, we are doing well right now. In many countries of the world, by the time you are retired, maybe you are working with the government and you have spent 35 years in service, and now you are retired or you are planning to retire. At that time, many people end up with many health challenges that takes away their life savings. A lot of people have who thought they were millionaires before, when they had one minor or maybe major healthcare challenge, they started begging about. It's not their fault because health is wealth. Health is central to human happiness. Health is also central to your well-being. And what do I mean by this? When you are healthy, yeah, you're fine. When you are healthy, there's so much you can do. You can go to work, you can do so many things. But when you have challenges with health, what do? The system that you are in, is it helping you to solve the problems that you have? That's one thing you need to think about. Your current country of residence, if you have an health challenge, are they able to take care of you? The cost of the healthcare service, is it affordable? So those are some of the things that you need to think about. But I would like to ask you this. Maybe I will just wait for one or two people to respond to my question. Are you currently satisfied with the quality of healthcare in your current country of residence? Just type yes or no. Let me see. Let me just air. Yes, I want a yes or no to this question. Are you currently satisfied with the quality of healthcare services that you have in your current country of residence? Let me see your response. Oh, okay, no. Okay, I can see people are writing no. Someone said no again. Yeah. Okay. Well, I'm here to share my own experience with the Canada Health Care Service. But before I go on to that, life expectancy in Canada right now, if you are a female, it's 84 years. If you're a male, it's 80 years. I want to be sure that one of the factors that they considered in arriving at this figure is the healthcare service. There are many other countries that when you check their life expectancy is 47. Some are between 47 and 50, and some are lower, and some are in between that. But for Canada, if you are a female, 84 years. If you are a male, it's 80 years. So I'd like to start by talking about my personal experience in a country I'd once lived. I don't want to mention the name of the country, but if you can guess, well, you may try to guess right. I remember very well when when we were about to have our second child. I want to tell you a little bit about the experience my wife and I had when we visited the hospital. The first thing, definitely, you have to go for prenatal care. And I remember vividly that we actually went for that, and we were told when we went there, they told us to come on time, that if you come late, they will send you back. So because of that, and they told us the clinic opens at 8 o'clock. So we had to wake up very early. We tried to get there early. We got there at around 7 a.m. or thereabouts. Went on to submit our cards. They did the preliminary examination. Not even examination. What I mean by preliminary process, getting your card out, getting your file out. It took us like 3 hours to get that out. Finally, after they've gotten all that, it took us under 3 hours to see a medical doctor. When I found out about the cadre doctor, he was a junior officer. And meanwhile, what I actually expected was that the consultant was the one that would attend to us. That was my thought. But it was one of the junior officers that came to see us. But that was still fine. At least someone saw us. But not after we had spent like 6 hours, in the clinic waiting to be attended to. This is in a country where I once lived. I said earlier on, I will not talk about the name of the country. Now, they gave us a list of tests that she had needed to do. She was pregnant, she was stressed, but I felt, okay, let's just do this thing and complete the process that same day so that you won't have to come back here. Well, we went to the lab. We got there, they told us we were late. That was like maybe like 2 o'clock in the afternoon. That they are done for today. That test, they can't run it again today. We needed to come back the next day. All right. We left. We had no choice. The person looked at the slip they gave to us. She didn't say anything. Well, we left and came back the next day for the test. And I was surprised when we got there. We got there early, maybe like 10 or 15 minutes past 8. And they told us that day they could only take 20 samples. And that they already have 20 samples. We had to come back again. In fact, my wife was really annoyed. She wasn't happy at all. And I even remember also, finally, when she was in the labor room, finally, when she was about to give birth to our second child, the doctor that was seeing her then was shouting at her, "Can you stay in a place? Someone is going through pain. She's in labor pain. You are shouting on the patient." In fact, my wife had to tell her point blank that if you are not ready to attend to me, please leave me alone, because she was annoyed. So what am I trying to say is this is an experience that I had myself when I was in a country that I once lived before. And apart from that, I remember very well that the medical test they told us to do, you will go and collect the form for the exam, for the test on the ground floor. You go and cost it on the third floor. You go to maybe the 6th floor to go and collect the bottle. After you collect the bottle on the 6th floor, you will take it to, as in just pushing you up and down, till you are tired, you get tired of the whole thing. This was an experience I had, and let me tell you something. Before I changed my career, before I came back to Canada to study mission consulting and change my career, I used to work in the medical settings. Yes, I was a senior member of staff in an hospital that is well known all around the world. So this is me as a staff going through this experience. So if I, as a staff, could pass through that kind of experience, just imagine what um, an ordinary person, someone who does not know anybody in the system, imagine what that person will pass through. It's always stress, stress, stress. I'm sure many of you can relate with this experience that I talked about. That is a few of there are so many, there's a lot to say about that, but that's not what we're dwelling on today. We are talking about my experience in Canada. So I would not talk too much about the experience I had in the other country. So now let me now tell you the experience I had here. I remember when I migrated to Canada, my wife was pregnant when we landed, and we had to register for prenatal care. We booked an appointment first. We registered with one of the clinics. We booked an appointment, and they gave us an appointment and told us, come by this time. We got there 5 minutes before the time they gave to us, and it was so funny that when we got there, within 10 minutes of getting to the hospital, they called her in. They did a lot of examination. We didn't have to wait for 6-7 hours, as I told you. We experienced in the other country I was talking about earlier, where I lived before. But here, within 10 minutes, they went to her. The doctors were very friendly. It wasn't the junior doctors that saw her. It was a consultant. The consultant saw her, attended to her. She gave her, after seeing her, they gave her tests, told her also to go and do ultrasound. I remember that vividly. And she took the slip for the tests to the lab, and they attended to her. She didn't have to waste time. As in, we spent a very short period. As in, when we got to the lab, in like 15 minutes, they had attended to us, took our blood samples. But the one that was funny to me most was they told her to do ultrasound. And when we got to the venue for the ultrasound, she went in, and she was there for like a little above 1 hour. I was waiting for her, and I was wondering what's happening, just to check the baby. I remember very well we had done ultrasound when we were back home. We did ultrasound like three times or thereabouts. You do ultrasound in 15 minutes, you are done. They were there for over an hour. When she came out, when she told me her experience, she enjoyed it anyway. The way they do the ultrasound air, where we went to anyway, was the fact that they are checking. You are sent to do ultrasound because you are supposed to have a baby. Does not mean they will just check the baby alone. They will look at your liver, your kidney, all your internal organs, everything. They want to be sure you are fine. So they don't just do ultrasound to just check the baby alone and say, okay, the baby is fine, it's kicking, is this is the position of it. They will check everything inside you to be sure that for them, that's a good opportunity to do a general test. As a general test in terms of examining all the organs inside of your abdomen to be sure that nothing is wrong. So you see, when we talk about preventive healthcare, you get all those kind of things here. Because now you didn't go there to test your liver, to test your kidney, but in the course of doing ultrasound to check whether your baby is kicking, to check the age of your child and the likes of that, they take time to look at all those other things and ensure that you're fine. Now, the other thing that amazed me was they gave her a follow-up. The doctor gave her a follow-up appointment. They were so courteous. They were very caring. You want to go back to the hospital? Yeah. They gave her a follow-up appointment. And what amazed me most about that was a week to the appointment, they called. 4 days to the appointment, they called, reminding her that don't forget you have an appointment this day. 3 days to the appointment, they called. 8 days to the appointment, they called. Unfortunately for me, the phone number she wrote down was my phone number. I got tired of those calls because, I had applied for so many other things. I was waiting for so many other calls. I would just see my phone ring. I would assume, oh, this is a call I'm expecting. They just say, oh, is this blah, blah, blah. just to call you to remind you that you have an appointment on this day. You know. Now I want to ask you, how many of you, how many people here, is yes or no, have had appointments with their with doctors, and the doctors keep calling you, at least maybe a week to your appointment, they call you, 4 days to the appointment, they call you, 3 days to the appointment, they call you, a day to the appointment to call you to remind you that, oh, you have an appointment. Is that the experience you have in your current country of residence? And why they do this is because they want you to come. They want you to come. They want you to come. They want you to come and see the doctor. I remember very well where I came from also. If you come late for appointment, they will chase you away. They tell you, the doctor, you are late. But here, the doctors were calling, or the doctor's office, they were calling to remind us that you have this appointment. So I have to tell her, please go and change the next appointment you have. Please change the number on your card, on the record that they have about you. Change the number on it to your number so that they can always call you. You can pick the call and talk to them directly instead of them calling me. I also remember one time my daughter had a sore throat. Sore throat, what we just think is a common sore throat. They did the test for her. They wanted to find out if it was a viral or bacterial infection that made her have a sore throat, even though they still gave her something that would take care of it. And the next day the result came out. The doctor actually called my line, but I don't know how come I missed the call. I don't know, I just missed the call, but I didn't know he called anyway. I was surprised in the evening to see, I just heard someone, I was at home and I just heard the bell of my house ring. I opened the door and I saw the doctor. I was so scared that, what's this doctor doing in front of my house? Coming, if the doctor comes to your house, I'm like, I was so scared that, hope it's not serious, maybe it's very serious. That's why the doctor had to come. But no, the reason why I came was, he wanted to give me a prescription. He called me to come and pick it up, but because I didn't pick my call, he now came to the house to drop the prescription. This is a country that service here, they give the best of service. When it comes to healthcare, you expect the best quality healthcare. And the only reason why I came to her house was because he felt she needed to buy some drugs, and he just came to hand over the prescription to us. Now let me tell you my own personal experience too. When I got here, I'm over 40 years, and I remember that the first 40 years of my life, I can't remember really going to a dentist except when I was young. When I had to remove some of my teeth, then my mom took me to one hospital, then when I was really young. But I can't really remember going to see a dentist, But here, it's something that you need to do. I went there, I enjoyed myself. It was fun. You see latest equipment. The doctors, the dentists were so nice. They filled the holes in my teeth, and they did fluxing, or a lot of things that over here we see they see it as normal things, but back home where I came from, we see those things as maybe luxury, or why should you have to go, or maybe many of us are even actually ignorant. You have your teeth for a very long time. There are things that you need to do. But here, we were educated about it, and I actually went for that experience, and I enjoyed it. I did all the things I needed to do. For the first time, when they asked me, have you been to a dentist before? I only told them when I was young. They were shocked that, why have you not done this in over 40 years? That's not right. I also remembered I went for what we call blood work. I just went to the lab. I went to the doctor. The doctor gave me prescription to do a general health check. That is one thing that you do here free of charge. You just go. I just went to the doctor is just 5 minutes drive from my house. He did the general blood work. He gave me a prescription to. He gave me a lab tests, a lab form to go to the lab to do tests. They did so many tests for me just to check, just to be sure that I'm healthy. I tell you that in over 40 years that I've been I've been in this world, I cannot remember any time I went for comprehensive health check. Yeah, it's a fact. This was the first time I would do that. Don't forget that I told you earlier on that I used to work in an hospital when I was in the former country. I worked in an hospital. But I tell you, for the free of charge, the first time I went for a total health check, did the blood test, examined me. He didn't say anything, but he just felt okay. Do this do the following test. The general test, all the tests were done, all just to check is your liver functioning well, your kidney. Do you have what's the quantity of cholesterol in your body? So many things. They did a lot of tests, free of charge anyway. I didn't have to pay for it. Finally, when he came back, he said he saw one value for in my liver stuff. He said it was just high by 0.1, but he wanted to be sure. So he said, okay, I should go and do hepatitis B test, which I went to do. It came out negative. The guy said, okay, I should go and do ultrasound. He just wanted to be sure that everything is fine. I went for ultrasound also. I assumed that, well, you want to check my liver. It's just going to take me like 20 minutes. You just put the ultrasound machine on it and check, and I got there and I was there for over an hour. When it was 1 hour, I asked to talk to the person taking it. I told her I have an appointment. Yeah, because why did it take me so long? They checked my kidney, checked my everything in my tummy, everything. I was like the same experience my wife had earlier. When she went for ultrasound because she was pregnant, they checked everything in the abdomen. They checked everything. I was like, that was the first time in my life I would ever do an ultrasound. First time in my life. They checked everything. And the only reason why the doctor referred me was just to be sure that my liver was fine. It was actually fine because the doctor called me the next day and said, no, everything is fine. I'm good to go. So these are things that you expect from a country that values healthcare and the likes of that. Now, the final experience I want to talk to you about is my son. My wife and kids went to US sometime last year, and my son fell ill there. He was admitted into ICU in US, and if you spend one night in ICU in US, the cost for that is about $20,000. Anyway, they treated him, and I later found out that government of Canada can actually assist to pay part of those fees. And I wrote to them. I sent them details of the bill and everything, and I tell you that they paid part of the fees that are incurred in the US. That is a government that is bothered about the healthcare of its citizens. So what am I saying in summary is that no matter the health condition that you have, no matter the cost of the health condition that you have, if you're a permanent resident of Canada, if you're a Canadian citizen, you would not need to pay. You will not pay any money. It's free of charge. Healthcare in Canada is free, and you are getting the highest quality of healthcare service. It's not substandard. You get the best care. You have consultants coming to you, experts in the different fields that you have issues coming to attend to you. And you are not going to pay anything at all. It's free of charge. The hospitals might be very close to you. Many times you don't even have to go too far. But even if you have to go far, maybe because you need a specialist service, you are sure that you are getting the best of services, and you are confident that even if you are sick, at least you are going to get the best from the government without you paying. So when we talk of preventive health care, you can always do your health check regularly. If it's once a year, you can do that conveniently without you having to think of the costs. And if you're actually sick, you can go to a clinic. They will take care of you, give you drugs, examine you. You are sure that they will give you the right diagnosis because they have the right equipment. Quite unlike many places where they can misdiagnose you, or maybe possibly that it's a junior officer that is coming to see you. I remember very well when my wife was finally, when she was our second child, before the consultant that was assigned to her saw her, she had gone to the clinic for more than 7 months. The consultant in charge of my wife then back home, my former country resident, before he saw her after 7 months that she had been coming to the clinic. That was the first time she had met the consultant. But here, from the first day, a consultant saw her straight away. So one good thing, and I'm sure many of us know that by the time as we are growing old, so many health challenges, we have so many health challenges. Some of us have arthritis, some of us have diabetics, some people have high blood pressure and the likes of them, which requires you seeing a doctor or receiving treatments. Here, if you're in Canada, all those things will be taken care of free of charge. You will have access to the best healthcare, to the best doctors around the world, and you're not scared that they will misdiagnose your condition, or you're not scared that you will not get the right treatment. You have access to quality healthcare in Canada. And for me, that was one major reason why I decided to migrate to Canada. I wasn't someone, I didn't want to, I never planned to travel before. But when I weighed everything, I looked at it, I can tell you that it's one of the major reasons why I sat down and thought of it, that it's better for me to be where I'm sure that my health will be taken care of well if I ever fall ill. And even when it comes to preventive health, you are sure that I'm going to get the best from that. So if you are considering coming to Canada and you have any health challenges, or you think if you don't have now, you may have one or two things later in the future or whatever, free healthcare services in Canada is free. So this is one major reason why you should consider migrating to Canada. As I said earlier, I'm the principal immigration consultant of TrueLink Immigration Services. We have a head office in Edmonton, Canada, and we have a branch office in Ibadan, Nigeria. If you want to migrate to Canada, we can assist you. We have assisted so many people to migrate to Canada in the past. I also migrated to Canada. So as I said, is what we have done for ourselves and for others that we're talking about. We're not people that will tell you we can help you do this, but we can't do it for ourselves. It's something that we have done for ourselves, and we can also help you. And we have assisted so many other people to come to Canada. Even if you want to study in Canada, we can also help. If you want to come here to study, there are so many programs that are available that you can study. If you want to come here as a visitor, if you want to visit your friends, you want to visit your family members, or you just want to come for holiday, we can actually help you achieve that. That's what we do. And if you also want to work in Canada, we can help you with that. That is what we are licensed by the government of Canada to do this, and we have assisted so many people to do that. If you also want to invest in Canada, is one of the things we do. We can actually help you get the business you can invest in. If you want to start the business afresh by yourself from scratch, we can guide you. There are programs. There are so many programs that you can use to migrate to Canada. In fact, right now, there are over 80 programs that are available that you can use to come to Canada. So if you want to migrate to Canada, study in Canada, visit Canada, or invest in Canada, I would advise you contact us. Our website is showing on the screen, www.truelinktravel.com. On our website, you can get a lot of information about us, what we do. And if you want to call us, this is our Canada number and a Nigerian number. You can call any of those lines. You'll be able to reach us directly. Our Canada number is +1 780 250 7011. Our Nigerian number is 090 87416 444. And if you want to reach us on WhatsApp, you can also you can also chat us up on WhatsApp. Our WhatsApp number is +1 587 568 6124. So I encourage you to follow us on Facebook, Twitter, and Instagram at TrueLink Travel. That's our handle. And you can also subscribe to our YouTube channel, which is also at TrueLink Travel. This video will be on our YouTube page when we are done today. So if you want to watch it later, or you want to send it to your friends who may want to assist you to migrate, or your family members who want to help you to migrate, or anyone that you know that wants to migrate to Canada, you can forward it to them. You can be sure that if they watch it, they will learn one or two things, and they can always contact us to help them out with it. So this is why I'm going to stop today. I'm sure that you have learned one or two things, or at least I've been able to talk to you a little about one reason why you should consider coming to Canada. If you have any question, I can take a few questions, maybe 3 or 4 questions, before I end this online live program. If you have any question, you can just type it. I will be able to attend to it briefly. You know, so there are. In fact, I just remember very well too that one other reason why people need to consider coming to Canada or migrating to Canada, the current COVID-19 pandemic has actually crippled a lot of economies. Yeah, it has a lot of economies in the world. But despite that, there are so many things that the government of Canada put in place to assist citizens and PRs a lot, you know. So, but that's not the topic for today. Today is just purely about healthcare services and why you should migrate to Canada. So, if there are no questions, I would. Okay, someone asked how long is this process? The process can take as the average processing time is about 6 months. About 6 months as the average processing time. But we have done some processes in 2 months. I can tell you that. It depends. We have done some processes in 2 months. There are some of our clients that got PR in 2 months. So, but the average processing time is within 6 months. So you can be sure that that's why you need to start on time. Start on time so that if you start now, just look forward 6 months from now. Just make a plan 6 months from now how long you can be in Canada. Someone said, how many months will it take to get visitor's visa? You can get a visitor's visa within 30 days. It depends. When we submit your application, we'll look at the current process time and we're able to update and tell you that, oh, as of today, this is the current process time. But at times, the process time can be within 30 days. It's possible. I want to study, contact us. Someone I want to study, just contact us. I gave you our contact number. I also gave you our WhatsApp number. You can go to all these numbers on our website, www.truelinktravel.com. So you can get all these numbers on our website, or all these details on our website. You can call us, you can send a WhatsApp message, or even chat us up on Facebook, Instagram, and Twitter. We'll respond to your chats. We're online, where we do a lot of online discussions with clients and so many people. So you can chat us up on any of our social media platform or on our WhatsApp message, on our WhatsApp phone, which is +1 587 568 6124. So, thank you.